Lorraine, welcome to the show.
Thank you. Thank you for having me. I'm excited.
She is sharing her story at 44.
Struggled with infertility for a really long time, and I've had a lot of obstacles to get to motherhood. Thankfully, I'm here now with a 15-month-old healthy boy. We were engaged, and through my 30s, I was always kind of struggling. Not struggling, but I knew there was something not quite working. Not that we were actively trying to conceive, but I just realized I was getting towards my mid 30s, and I thought something's something's not working. And unfortunately, he passed away after an 11-month battle with colon cancer.
Mm,
So it was a really tough time, and it was a really tough position to be in when you're losing somebody you love. We were engaged and living together at the time. I never thought that I could be strong enough, but you figure it out and you just do everything. At that point, before he was diagnosed, we had done one visit to an infertility place to just kind of get a consultation,
mhm.
and then everything changed. So after I lost him, you go through a lot in grief, and it takes so many different forms. Grief.
Mhm.
It's not just being sad. You go through anger and guilt, and you make bad choices and you do things you never thought. Grief is like this backwards, forwards, upside down.
It's really
And
complicated.
so I was 38 at the time. He passed, and I took some time and I met my now husband 2 years later. I was not quite 40. I met Adam, and it was just like, this is it. We clicked right away. And he was 5 years older than me, and neither of us had children yet. I always knew motherhood was in the cards for me. I was feeling like the window was closing, and
Because
because of my age. Mhm. At 40, I said, we might need to do some infertility treatments if you want to have a family. And he was actually on board right away. I think we were together about a year, and we decided to go through IVF.
mhm.
So we did that. And in 2018, we got 10 embryos, right?
Wow, that's
Well,
amazing.
only three went to,
A blast?
yes.
Okay.
So we got 10 originally, and three made it. I'm sure you're aware of the process of having them tested, right? To test for
Mhm.
Down syndrome, etc. So that's a big out-of-pocket expense. Probably you probably know, but we
Yeah.
we decided to do it, and we had some family all come together and help us with the funds to do that. And we
Oh,
got
that's
them
great.
tested. Yeah, we got them tested, and out of and those three. So with the testing, you find out the sex, right?
Mhm.
So we knew we had the two boys and one girl. At that time, we were very excited to move forward, and my fertility doctor said, with your fibroids, I'm a little nervous about doing a transfer. I don't feel like you would have a could have a successful pregnancy unless we remove these fibroids. And so he said, I recommend we take them out, let your uterus heal for 6 months, and then do an IVF transfer. I said, okay, I'm up for whatever's the best outcome.
Were you
So
not worried about waiting the 6 months? Because that would be the first thing in my head.
I really trusted what he was telling me,
Okay.
and I just said, let's do it, because he saw quite a few. And so in January of 2019, I had the uterine fibroid removal surgery where they actually open you up. It's a C-section, and they opened me up from, it was just exactly like a C-section scar, and they took out 12 fibroids, all different sizes. Yeah.
Wow, that's incredible.
So they did that and put me back together. And then while I was healing, that's when we decided we'd get married. so, so we planned a wedding. And in the fall of 2019, we put together the wedding. We went and got married, and we thought to ourselves, okay, when we get back from our honeymoon, we are going to do the transfer. And we were really, really excited. And we went to Hawaii for our honeymoon. And I got off the plane knowing that, oh, sorry, I'm going to back up a bit because this has to do with my mammogram. So right towards the end of the year, I always would go to the eye doctor, go get my mammogram, go get my teeth done. I always kind of did all my health stuff towards the end of the year. So I was putting all these things together, but I was also planning a wedding. I was really busy. Got this letter in the mail. It said, "Don't forget, it's time for your mammogram." And I really honestly could have just ignored it because I was so busy and things were so crazy. And as you know, probably all women know it's nuts putting together a wedding. But I didn't ignore it. And I'm so thankful because I went in for a typical mammogram right before I got married. And they called me back and they said, "We saw something. We need to take a look." And, okay, that's happened before and it was fine. So I went back, and right before I flew out to my honeymoon, they said, "When you get back, you need to come back and we're going to do a biopsy." So, of course, I didn't tell anyone. I didn't want anybody to worry during my beautiful wedding. I didn't want my mom or anyone to just be freaked out about what was a possibility for something bad. And we did have a wonderful wedding. I was at my honeymoon thinking, "Oh, when I get back, I gotta do this biopsy." So I flew back and I remember coming back on a Monday. We flew in on a Monday morning and I went in that same day when I came back, that
Wow.
same afternoon. I went in, my husband took me to get that done. So 2 days after coming back from my honeymoon, I got the call that
Mhm.
you have breast cancer. And that poor radiologist who called me, I feel for him still because he was calling, what a job to have to call people to tell them that it is cancer. And I was sitting in my car and he called me and he said, "I'm sorry, your results are in and you do have invasive ductal carcinoma. It's a breast cancer." And my first reaction to this poor man was, "No, like I'm about to do a transfer. I'm supposed to do an IVF transfer. Like I can't have breast cancer. What do you mean? Like I can't." It just hadn't sunk in. I hadn't really, my focus was just on this, motherhood. And I
Probably
just
a
was like,
little bit of denial too.
yeah, I didn't want it to be. I didn't want it to happen. I was like, no, like I've waited so long. The other surgery had just healed from and getting ready. And so, yeah, so my motherhood was delayed. And luckily, we caught it early. So I always like to share with women to please don't ignore your reminders because I had no symptoms, no breast cancer symptoms. It was a normal mammogram that caught my cancer, and I caught
Uh-huh.
it early.
And
So
how old were
luckily,
you?
I was 41 years old.
Okay.
Luckily, though, catching it that early, I didn't have to do chemo. So what I opted for was a bilateral mastectomy because I had already had some lumps removed from my right, and the cancer was in the left. And I said, "You know what? I want to do both because I didn't want to take that chance because I'd already had scars and surgeries on the right. So it's just made more sense to me to do both." I have my aunt, she had already gone through the same type of breast cancer and she had removed both. I really leaned on her for some support and I went that same direction. The following month, I had a bilateral mastectomy with reconstruction. So they put some implants in for me. After that, I spent a year and a half on tamoxifen. It's the hormone blocking treatment that they put a lot of women on
Hmm.
to make sure that there's no reoccurrence. My oncologist at the time knew of my plans and my embryos waiting and said, "There isn't a lot of studies for women that have gone through breast cancer and how much tamoxifen or how long they should be on it before
Hmm.
going through IVF." I was in this small little category, and he said, "I'd really like you to do 2 years of it, and then we'll reassess where you are and look at everything."
Hmm.
So I didn't quite do 2 years. I did about 16 months of tamoxifen,
Uh-huh.
and I went back to him. And at 43, I said, "I'd really like to try." He said, "Okay." He gave me the green light
Hmm.
and said, "Okay, you're going to get off of it." And he said, "You got to wait 6 months." Now here's another,
Another
kind of,
6 months.
another 6 because it's a hormone blocker that you've been on for so much time.
Yeah, that makes sense.
Yeah, it essentially doesn't put you in menopause, but it was
Mm,
still having a period, which was good, but it blocks hormones to keep you safe.
yeah. And your mental state during these 2 years, how was that?
I was frustrated. I I felt, God, this is so unfair, but I still did not give up hope.
That's great.
I knew inside me that motherhood was waiting.
Mhm.
And so in that respect, that's why I nudged my oncologist a little more than previous to being done in 2 years. In December of 2021, we tried our first IVF transfer. I was 43 at that time, and I had a miscarriage about 6 weeks. I did get pregnant,
Do you
and
remember any of your HCG levels?
they were really, really good. They were really high.
Ugh,
It was a very big surprise. The miscarriage was a very big surprise to my doctor. He was very shocked that happened. You can't prepare yourself for miscarriage. That was really, really tough on me. I just another, moment of okay, maybe it's not in the cards. Maybe this won't happen. But I know we had two more embryos and I didn't want to give up. So my fertility doctor said, okay, let's have a couple regular periods. Once that has happened after this miscarriage, we can try again. So that's what I did. I told you before we had the two boys, one girl.
mhm.
So our first attempt was a boy. And so the second attempt, we said, let's try for the other boy. And we did.
Did you try for the boy the first time, or was that just the best embryo?
They did tell us that the best embryo were the two boys, but he also said if you wanted to try the girl, she's just as, I guess the numbers were just a tiny bit.
Yeah.
Yeah, he said I'd still have great possibility, but we wanted to try for a boy and we did that. We made that decision again and our my second attempt I was 44 and it worked. And I did get pregnant.
Will you walk us through like your transfer and then your 2 week wait?
Well, when I did IVF, I did do acupuncture
Mhm.
prior and after. So I kind of continued some of the acupuncture for a while. And then the 2 week wait was because I had just gone through miscarriage months before. This time I was a little more reserved in being excited and a little more reserved in trying to you know, get my hopes up a little too much. It was just different. It was a different process. I was more, ready, I guess, putting myself in that okay, this could happen again. I could have another miscarriage or maybe this won't work. And so I was more reserved this time around. I wasn't as anxious and my numbers were good again. I got pregnant and we waited a lot longer to tell people
Mhm.
because of the previous attempt. So yeah, I we waited quite a while, except for our immediate families. And but yeah, I mean, I don't recall. I know that I did test before the 2 weeks, and I saw that my tests were positive.
Mhm. Do you
It was
remember
still
what
that.
day? Yeah. Do you remember what day you tested?
No, I don't remember what day I tested. I remember he was transferred on Friday the 13th because the doctor was like, "Do you want to wait and do some other day?" Because some people are a little weird about Friday the 13th, and I was like, "No, no."
No, who cares? So, what was it like getting that call confirming that you were
Mm.
pregnant?
It was bittersweet because I know I had just had a call like that. It didn't work out. It was like, okay.
So, what was it like getting past your 6 weeks?
Mhm. That was probably more stressful than the 2 week wait.
Yeah, I get that.
I was counting though that time frame. And I was counting. You do so much Google like searching and you go through all these like what are the statistics? And I was looking all these things up and I was kind of driving myself crazy for a little while.
Yeah, that's easy to do. But you saw
Mhm.
the heartbeat at 6 weeks.
Mhm.
Yeah.
did all the anatomy scans, and every time we had such great treatments, and it was growing and everything was great. And it was like every time we went in and we're like, okay, I'm sure all women feel that way. It just, is this all right? Is everything okay? And thankfully, he grew really on time. He had all those marks. And I remember that anatomy scan because we saw his foot,
Mm,
and he would keep covering his face. He kept doing this. We didn't get any, my entire pregnancy, we got no really cute, like facial shots, like cute little, like, because he was always like covering his face.
mhm.
So it was just a first for both of us, for everything, for the entire journey. We had gotten married, and you think you're going to start this life together in a certain way. And for him to see me get that call about the cancer and then go through that surgery, gosh, he saw me go through so many surgeries just in the first 4 years of knowing each other, really.
Yeah.
So
How was your pregnancy? Symptoms and overall, how would you describe it?
I would say it went pretty well. I had a lot of heartburn, and I dealt with Tums a lot, and really trying to like take note of what I was eating, not too late, or I wouldn't be able to sleep well. I did end up swelling in my feet and legs tremendously, like really, really, really swollen feet,
Mhm.
where I had to order special shoes
Oh
to get
no.
shoes on, those Velcro, fun Velcro shoes, and extra large socks. And I was still working, and it was really tough. We were monitoring my blood pressure towards the end there, and I was kind of teetering on preeclampsia. And the reason why, oh, and because of my previous uterine fibroid surgery where they opened me up like a C-section, my doctor said, this is going to be a C-section
Yeah.
delivery. I knew that from way beginning that I was
Hmm.
going to have. And so there wasn't really a lot of anxiety for labor. I didn't have that anxiety of going through labor. I knew it was
Hmm.
going to be a month. So we were looking at dates. And then as I teetered on preeclampsia, we said, let's try and get to this one specific date in January. And we ended up doing it like a week and a half before that because I did like end up falling into a preeclampsia, like as we were monitoring. I knew it. Like I remember having that doctor appointment that specific Wednesday. It was January 4th. And we went in, and I took my hospital bag with us, and I said, I have a really bad headache. My blood pressure's like all over the place. So we went in that day, that morning, and he looked at everything and he said, your son is over 6 pounds. I'm not worried about that part. I'm more worried about you right now. Let's deliver today.
Hmm.
And I was like, oh, so we went straight from the doctor.
Today.
Yeah. We went straight from
Whoa.
the doctor's office to the hospital, like straight from one to the next.
Uh-huh.
And they kept me in, and one nurse came in and she mentioned something about contractions. I go, she must be getting me confused with somebody else because I'm not having contractions. I'm just
Uh-huh.
here. We're gonna do C-section. And then she left and she came back and they had all the stuff on me. I'm like, I'm not having. She goes, no, you are. She showed me the monitor. She's like, oh, there's another one. And I'm like, what?
Oh wow. I do
We
have a few more questions before we get to that.
okay.
Did you use the same doctor that you used like with your fibroid surgery and all of that?
The fibroid surgery was a different doctor, but in the same referral like system. Like my
Mm,
fertility doctor wasn't a surgeon in that respect. So he referred me to another doctor who did that surgery.
okay.
Then they also referred me to my OBGYN. So three different doctors in this situation.
Gotcha. Was there anything important to you about an OB?
I was really hoping to have somebody that had experience with older
Hmm.
women. And so one of my first questions when I met him was my age and, everything going to be okay? And have you dealt with women in their 40s? And he's like, oh, yeah. Oh yeah, we just had, he started giving me examples and I love to hear that, when you're in there and they start telling you, "Oh yeah, we just delivered for to a, 49-year-old or what have you." And oh, okay, your anxiety level goes down a little more.
Yeah,
I
it
want
really does.
a doctor that says, "Oh yeah, I've done this and it's okay. And there's women that have been older than you and you're okay."
Mhm.
So that was important and we did find a good one. He took good care of me.
Yeah, good. Was there any product that helped you through pregnancy that you could recommend?
They had me take some specific vitamins, but honestly, I can't recall the name of them right now. I did some acupuncture.
Mhm.
I'm not sure if I felt different after acupuncture, if it really made too much of a difference, but it
Mhm.
worked for me. So
Yeah.
they do have some doctors that really steer you to do it, and mine
Mhm.
did. He really wants you to see this acupuncturist. She's had a lot of success, and I went to her and I did that for a while.
Okay. And what about diet and exercise? Did you change any of that whenever you became pregnant?
I really was on the biggest mission to drink more water. I am really bad at that. And struggled with doing it. I would just forget. I mean, I don't know if you're like that, but I would just not think about it. And pregnancy was just like, you got to set a timer. You got to make sure you're drinking water, more fruits, more vegetables, and just, I mean, I did my best, but definitely probably wasn't as good as what some women do. But yeah, I did some exercising, I walked, I did a lot of trying to stretch and wake up and stretch and really keep myself from getting rigid and keeping that movement. I probably could have done more.
Yeah, I know we could have all done that, right? What about cravings or food aversions? Did you have any of that going on?
I ate a lot of peanut butter and jelly at some times. Like they would be these little like snacks that I would want. I said, because people ask me that during my pregnancy at work. They're like, "Oh, are you craving anything?" I'm just like, peanut butter and jelly sounds good any time of the day. Breakfast, lunch, or dinner, I'll take a PB&J.
Mhm.
But I don't really recall anything, specific or not wanting to. I remember having those lozenges when I would feel a little nauseated, like those lemon drops.
Mhm.
Lemon drops helped me with nausea.
Mhm. And because this is your first child, how did you prepare for baby? Classes, that sort of thing?
So the hospital that I was set to deliver offered online classes, and I took all of them. I went in and signed up for everything, and it was all Zoom. So you could be home after work, and it was all in the evening. And I Zoomed with other couples and learned about all the different. They talk about your. I'm trying to think how many different topics there were, but it was everything from what to expect at delivery to all the different things to do afterwards with a newborn, to care for a newborn. And then my husband and I went to one in-person class where we sat with some other couples and they showed you how to diaper and gosh, there was so many different topics there too. It was fun. It was a nice because at this point people were still a little weary about doing in-person things. Just it was still there was like another COVID thing going on at the time, and I remember being, pregnant women getting nervous about going into spaces with other people. But we went to one in-person class
Is there anything else you want to mention about your pregnancy?
because I didn't have breast tissue anymore.
Mhm.
I know I wasn't going to be breastfeeding, obviously. So there was going to be a whole other facet of formula and which kind and what's best and bottles, what's best bottles. And so I had a lot of those supplies too.
Yeah.
Mhm.
So you felt really prepared going into birth.
I felt very prepared. I was
Awesome.
ready. And with the swell that was going through, the swelling I was going through, I was really just really ready to
Yeah.
be done with that part.
Yeah.
Uh, mhm.
So you went into your appointment at 36 weeks. You're staying, you got your hospital bag too. Tell
I
us what
did.
happened next.
So as I'm sitting there and they're checking us in, I thought to myself, okay, maybe we'll do this tomorrow morning. I'll get all settled in my room and we'll be, this C-section will maybe tomorrow, maybe it'll happen tomorrow. And they come in with the suit, that white zip up suit, and they hand it to Adam and they're like, it was about 2:30 at the time I was being checked in.
Mm-hmm.
And they come in and they're checking everything and they're like, okay, we're gonna do this at 4:30. And I was like, today? This is happening in 2 hours? Apparently my blood pressure had really started to go up.
Yeah, it was that high.
It was just, they said, yep, this has to happen today. And I said, okay. So he put on the jumpsuit and I took a video of him doing that because I was just like, I can't believe this is happening right now. I wasn't feeling any contractions yet. The screen was saying was having them.
Yeah. And you
So
couldn't feel anything.
no.
Oh my gosh, that's kind of one of my fears is that I'm in labor and I don't know it. It is a
It was
real
so
thing.
strange. I didn't know that was a possibility. So we did the C-section and it was after that I had contractions I was feeling. And I was like, oh my God, I'm in a lot of pain. I didn't realize that after you have, you're having contractions because your uterus is,
Going down.
you know, it's trying and so I was having contractions afterwards that I was feeling
Uh-huh. Well,
that were like,
walk us through the C-section. How was it?
I had given a playlist of music beforehand, one of those prep, they give you like, oh, what are all the different things the hospital gives you this list of what are all the different things you would like. We gave a little playlist. I said I was very nervous about lactation nurses coming in that don't know that I don't have breast tissue. I
Yeah.
didn't want to feel that sadness and disappointment and like, no, like keep having to say, I know I can't breastfeed, I can't breastfeed. But they were really, really good. The hospital I went in. But it was funny because when they wheeled me in for the C-section, they were playing some crazy music that was not what we gave them. It was like some house doom 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 doom. And Adam looked at me and I'm like, okay, like that's really weird. Like I wouldn't have picked that, but okay. So we had, I guess it was the anesthesiologist or one of the doctors that wasn't my doctor, it was somebody else who was playing some crazy house music or something. And so it was quick. I didn't feel anything. I was emotional we had
The sheet.
the sheet, yeah. And so Adam stayed here with me and then they kind of pulled him out and just kind of poked him over the sheet so I could see his little face and said, hi, my baby. And so my husband was the first one to hold him and they took him to another area and he cried and it really wasn't a bad experience. It was, I hate to say easy because I mean, how that's
Sure. It's
so many
surgery.
women have so much, yeah.
Yeah.
And but it wasn't tough. It was kind of planned and went through it together. They wheeled me into another area after it was all put back together and I got to see him. I didn't get to hold him for quite a while, but Adam took care of everything.
Mm-hmm.
He handled the first nights, he handled everything and all the feedings. I wasn't able to, move around or do much. I could barely walk
Uh-huh.
out to the bathroom. And he was hands on, all hands on, new daddy.
Yeah. How was that first night? Did you have him stay with you that night?
Yeah, he stayed most nights until, yeah, I think he stayed every night.
Yeah.
Mhm.
How long were you in the hospital?
Let's see, we had him on a Wednesday. I think I went home Sunday, so it was 4 or 5 days.
Okay.
Mhm.
And how was your recovery?
It still took almost a month for my feet to come back to normal.
Whoa.
In my head, because you don't know any better, I thought, oh, as soon as this baby's here, like I'll get my legs and my feet back. Mm-mm. I went back to the doctor. I don't know if it was a week later, and I was like, my feet, like, when is this gonna? He says, yeah, it's gonna take some time. And it did. It was like weeks until the swelling went
Yeah.
down. Mhm.
And how was the pain when you got home?
I had already gone through that fibroid removal surgery. So I kind of anticipated that kind of pain and recovery. And so it wasn't it wasn't terrible, but I would say I was really shocked about the contractions I was having afterwards. That was a
Yeah.
big shock. I didn't they don't tell you that. Nobody
Mm-hmm.
says you have contractions after.
Mm-hmm. Yeah.
And I had to still monitor my blood pressure, which went back to normal pretty quickly.
Oh, that's really good. What about formula? Which one did you go with? How did you decide on that one?
He was having quite a bit of what you would consider red face and just felt like he was uncomfortable. So right away we switched to the gentle ease,
Mm-hmm.
infamil gentle ease, and it helped a lot. And we kept him on that through his first, gosh, 9 months, 10 months.
Now, is that just one you can get at the grocery store or something? Okay.
It's the purple infamil.
Okay.
The
Gotcha.
purple one. I had started with Bobby because I had done my research with Bobby, that formula that was created by mothers, and it's like a European formula, and it was high end, and I was really like looking forward to using that. I don't know if it was just too much for he just needed something less, well, more gentle, basically gentle ease,
Mm-hmm.
because it just didn't quite seem like he was in digesting it well. He was having some issues, so
Gotcha.
I moved over.
And mentally, how were you during postpartum?
I was good. I am really thankful I didn't hit any walls in that respect. What I did was I got 5 months of maternity leave, which was
Wow.
great. Great job. I know. I had him in January. I'd worked right up into pregnancy. I had him in January, and I wasn't set to go back till May.
Wow. Now, did they pay for it or?
There was a Most of it was the state and the disability, short-term disability, and then it was family paid leave, and then my company gave me more time as well. I was getting like my 80% of my salary at the time.
Yeah.
And so knowing that I was due back in at the end of May, I really looked at my savings. Me and Adam had a really long talk about how we're going to proceed. And I had been with the same company for 21 years. And I said, you know what? I can probably stay home for the rest of this year, quit my position, stay home for the rest of this year, and then look for a new job next January. So I gave my notice and I didn't return after maternity leave.
Wow.
And everybody was very supportive at work,
Mhm.
long-term friendships, and very excited for me. And I did. I stayed home and I used some savings and I stayed home with him for his whole first year.
Yeah, that's great.
Yeah.
Is there anything else you want to go over about your pregnancy or birth or postpartum?
I guess like I just want to talk to other women out there and just always mention that there's hope, if you're struggling with any topics, especially health issues, not to give up. I know that it's hard sometimes. It's hard to continue to have hope, but your body is amazing. I went through so many different surgeries and losing breasts, and I was still able at 44 to have
That's
my first
amazing.
child. And We do have one more embryo,
Mhm.
right?
Tell
A
us,
girl.
what's the plan for your last embryo?
I'm now 46, so I still get that nervous feeling of, am I too old? You know. So since Mateo is now 15 months old, we are going to possibly do another transfer at the end of the year.
Mhm.
And that's where my head's at right now. I want to get into some better shape through the summer and really try to lose some weight and try to get myself more prepared physically. I think I could have done a better job the first time around of being more physically in shape. When you're down on the floor and you're playing and it's time to get up and you're in your 40s, you might feel it more.
Yeah. Yeah. Just talk to
So
Shirley. She'll make you feel better
I
about your boobs
know
too.
watching Shirley work out during our workout sessions is like, you go, girl. I wish.
Yeah. Yeah.
But she's amazing, and I'm that's my plan is to get into some better shape
Mhm.
physically, and possibly do another transfer later.
That's
Yeah, and I'll be
exciting.
46 and possibly having a second at 47. So we'll see. It's nerve-wracking to think about, am I really ready? Could I really do it again? But with IVF and having embryos frozen, it's interesting that the fees are there to keep them frozen and the options are interesting to think about. Like, if I really couldn't physically do this, donating or destroying just doesn't seem right for us.
Now, we've had 3 previous guests that has been pregnant since their show. So maybe you can be number 4.
Yeah,
That'd be really
come
exciting.
back. Hmm.
So, what has been your biggest challenge being pregnant in your 40s?
Probably energy level. Thankfully, my husband and I are a little opposite. Like, he gets up really early and he's like early bird guy, and then he fades kind of towards the evening. And I'm more like able to stay up a little later and get my second burst of energy. He's older as well. He's 51 now. And so teetering on figuring out that energy, teamwork, getting things done and having to work together to figure that out to manage our energy that seems like it's lower. I feel like we're lower energy, but just making it up by, okay, I need to go rest for a bit. Your turn. He gets on
Mhm.
the floor. We're throwing balls and playing and opening books and turning pages while the other one is taking a rest.
Mhm.
So I think energy level has been a big thing. And I don't know about you, but I'm a left-hander.
Me too.
It doesn't have to do with age, but what really surprised me is the way I have to hold him to feed him and the way I have to put him down to change his diaper. I have to do it so I can manage it with my left hand and clean him and do the diaper with the left hand. And then most people are right. And so they're handing him to me in the opposite way. And I'm like, no, you got to turn him. I got to have him this way, not that way. Because my brain, you might experience this when you have your child, because I've never realized, like, being my whole life being a left-hander, it really didn't come into play at all growing up. I mean, yeah, you got pen marks and you had to, like, in school you had to deal with being a left-hander in some aspects, but you don't really think about it. And then I have a son, and his direction and the way I hold him and the way people give him to me and the way I pass him is all left-handedness. It just has really become like a thing. Like, oh yeah, you have to turn him before you give him to the mom because the mom needs him over here. So weird.
Yeah, I thought about that with the diaper changing station that we put on the registry. I was thinking we're going to have to rotate it every time one of us changes a diaper.
Yeah,
Yeah.
it comes into play. It really does. From feeding to changing to bottles. I'm really like, I don't know, you got to have them in the right spot.
Interesting. I'm going to have to think about that whenever it
Mhm.
happens. Is there anything you recommend that would help prepare someone for pregnancy and birth over 40?
Do your very best to be in the best shape possible before you go through your journey. I
Mhm.
know I was told that. I could have lost a little more weight beforehand. I could have, you know, started better eating habits. So I really had to jump into some of that.
Mhm.
I didn't prepare myself as much physically as I should have, I think. But other than that, just having, if you can have that support team, whether if it's family or friends, it really makes, I think for any woman at any age, that makes such a difference. But I think when you're older too, it really helps with the the physicality sometimes. And luckily, I have a really great support system.
That's
Mhm.
great. And what advice would you give yourself when you were pregnant if you could go back?
Maybe not to worry us so much. I know it's hard to say that though.
Yeah.
Yeah. But stress and being worried all the time and comparing yourself to others and doing too much comparison, I
Mhm.
still struggle with that.
Yeah.
Comparing his level where my son's at now maybe should be, maybe to do less of that and just really just find ways that help you relax a little more, take your mind off things. I know we all have so much stress though, don't we?
Yeah. Now we have a lot of women who are trying to conceive over 40. What advice would you have for those women?
I remember going into each doctor's office, oncology and OBG, all of my plethora of doctors. And every time I went in, I'm too old. Look at my age. Is this going to happen for me? And I always was waiting for them to say, yeah, you're older. And then none of them ever did. So I think my advice to women in their 40s is to do your best not to tell yourself that you're too old, that this is not going to happen because of your age. And really to find out those doctors that give you that, yeah, this can happen for you. And let's not think about your age. Let's think about your weight or your eating habits, and let's think about exercise, and let's think about all those things. Let's not
Mhm.
think about
Yeah, a true
um,
diagnosis. Yeah.
mhm.
And where can our listeners find you on the internet?
I have a public Instagram and I put my journey on there for a while, and that one is Lolo underscore journey 78. That was kind of where I posted my journey. And if there's any women out there who are also struggling with breast cancer, post breast cancer, please don't hesitate to reach out.
Awesome. Lorraine, thank you so much for sharing your story.
You're so welcome. I'm really glad that you have this outlet for women.